What if, starting this year, your Social Security check could jump to $1,990 every single month, guaranteed? Or what if you got an extra $200 every month added to your current benefit, no matter how much you're receiving right now? Which one would make the biggest difference for you? These aren't rumors, these are actual proposals being discussed in Congress. And today, I'm breaking down both of them in detail so you'll know exactly what's on the table, how it could affect you, and what it means for the future of Social Security. This is breaking news that could mean real money in your pocket, especially if you've been feeling frustrated by all the talk of Social Security changes without seeing anything actually happen. By the end of this video, you'll know which plan experts say has the best chance of passing and which one could secure Social Security for more than a century. Stick around because I'll also show you how these proposals could benefit low-income seniors the most, and I want you to tell me in the comments, would you take the flat $19.90 a month or the across-the-board $200 increase? And while you're here, go ahead and hit that like button and subscribe to Social Security Post so you never miss these important updates. The first major proposal we need to talk about is the Social Security Expansion Act. This bill has been introduced in both the House of Representatives and the Senate. That's important because, as you know, a bill must pass both chambers before it can go to the president's desk for a signature. In the House, it's called H.R. 1700, and in the Senate, it's S. 770, introduced by Senator Bernie Sanders of Vermont. What's worth noting is that this bill has bipartisan co-sponsors, meaning lawmakers from both political parties have already signed on to support it. The Social Security Expansion Act is designed to deliver immediate increases in benefits while also making structural changes to ensure the program remains financially stable for decades. Instead of vague promises, it spells out exact dollar amounts and formulas. That's a big difference from other proposals that have relied on general language about improvements without clear guarantees. The Expansion Act puts specific increases into law and backs them with revenue measures to pay for them. The first, and perhaps most talked about, part of the Social Security Expansion Act is the across-the-board $200 per month increase for all Social Security recipients. That means whether you're receiving retirement benefits, SSDI, or survivor benefits, your monthly check would automatically go up by $200. Over the course of a year, that's a total increase of $2,400 in your pocket. This is a permanent increase, not a one-time payment. It's designed to help offset inflation and rising costs that have been squeezing seniors' budgets for years. If passed, this change alone would have an immediate, noticeable impact for every recipient, and unlike some proposals that phase in slowly, this would apply right away to both current and new beneficiaries. The Expansion Act also focuses on the people who are struggling the most, those receiving the minimum Social Security benefit. Under current rules, if you worked in low-wage jobs for most of your life, your Social Security check might be only $900 to $1,200 a month. That's barely enough to cover rent in many places, let alone food, utilities, and health care. This bill changes that by setting the minimum benefit at 125% of the federal poverty level. For 2025, that comes out to at least $1,600 per month for a single person. For some low-income seniors, this would mean a raise of as much as $660 per month. That's nearly an $8,000 increase per year. For someone living on the edge financially, this could be the difference between struggling to survive and finally having some breathing room in their budget. Another major change in the Social Security Expansion Act is how it calculates the cost of living adjustment, or COLA. Right now, COLA is based on a formula that tracks the spending of working-age households, not seniors. That means it doesn't fully reflect the higher costs older Americans face for health care, prescription drugs, housing, and other essentials. The Expansion Act fixes this by switching to the Consumer Price Index for the elderly, also known as CPI-E. This is an inflation measure specifically designed for seniors, so annual COLA increases would better match the real-world price changes you experience. Over time, this change alone could significantly raise lifetime benefits, ensuring your buying power doesn't erode year after year. One of the biggest concerns people have about Social Security is whether it will still be there in the future. Reports have warned that without changes, the program could face automatic benefit cuts by the early 2030s. The Expansion Act addresses this by lifting the earnings cap on Social Security payroll taxes for high-income earners. Currently, someone making $20 million a year pays the same amount into Social Security as someone making $176,100. That doesn't make sense. Under this bill, all income above $250,000 would be subject to the Social Security payroll tax. The vast majority of Americans, about 91%, would not see their taxes go up at all. But this change would bring in enough revenue to extend the program's solvency by 75 years, removing the threat of sudden across-the-board benefit cuts. The bill also creates a special minimum benefit that guarantees anyone who has worked a full career, 35 years or more, and paid into Social Security will receive at least 25% above the federal poverty line in benefits. For 2025, that's about $18,000 a year for a single worker, adjusted each year for inflation. This provision recognizes that if you've put in decades of work, you shouldn't be forced to live in poverty during retirement. It's a way of ensuring dignity and financial stability for lifelong workers, even if their wages were modest. Now let's talk about the other big idea, the $1,990 flat benefit proposal. This comes from the Congressional Budget Office, which analyzed dozens of options for improving Social Security's finances. The flat benefit would mean that every single Social Security recipient, regardless of past earnings, would receive the same monthly amount, $1,990. That figure is based on 150% of the federal poverty level for a single person in 2025. For people currently receiving less than that, it would be a substantial increase. For people receiving more, it could mean little change or, in some cases, a reduction from what they get now, which is why this proposal has both strong supporters and strong critics. So why are some experts excited about the 1990 plan? The CBO's analysis shows that this single change would extend Social Security's solvency for more than 100 years, far longer than most other proposals. It would also save the government an estimated $400 billion over the long term, while providing a reliable, predictable income floor for all retirees. This plan would be especially beneficial for low-income seniors, who would see their monthly income jump significantly. It also simplifies the system, making benefits easier to understand. However, higher-earning retirees who currently receive more than $1,990 might see their benefits reduced, which is where the political challenge comes in. The CBO compared the flat benefit with other popular proposals, and the differences are striking. Raising the retirement age to 70 would solve about 35% of the funding gap, but it would delay benefits for future retirees and hit physically demanding workers the hardest. Reducing COLA would save some money, but would solve only about 10% of the gap, and it would erode buying power for everyone. Another option, taxing all wages above $250,000 without giving extra benefits for those earnings, would solve about 70% of the funding gap and extend solvency by 50 years. But it's only the $1,990 flat benefit that completely closes the gap and adds more than a century of solvency, while also giving a meaningful boost to the lowest income recipients. You might be wondering why we should take these ideas seriously when so many Social Security proposals have gone nowhere in the past. The difference now is that both the Social Security Expansion Act and the $1,990 flat benefit have been fully analyzed, costed out, and tied to clear funding plans. They're not just talking points, they're complete policy packages ready for debate. Momentum is building because the trust fund's projected shortfall is getting closer, and lawmakers are feeling pressure to act before automatic cuts kick in. With enough public attention and voter demand, either of these plans, or even a combination, could move forward this year. That's why it's important for every beneficiary to understand the options and speak up. So here's the choice on the table. The Social Security Expansion Act, an extra $200 a month for everyone, a boost to the minimum benefit, a fairer COLA, and a plan to keep the program solvent for 75 years. Or the $1,990 flat benefit, the same amount for everyone, enough to lift millions out of poverty, and a way to secure Social Security for more than a century. If you could pick one, which would you choose? The guaranteed across-the-board boost, or the flat benefit that locks in a higher minimum for all? Let me know in the comments. And don't forget, hit that like button subscribe to Social Security Post, and turn on notifications so you never miss updates on your benefits. The decisions Congress makes in the next year could shape your retirement income for the rest of your life, so stay informed and stay involved.